All right. Well, thank you for allowing me this opportunity to speak today. My name is Dr. Kuenzler, and I'm the CEO of Jefferson Center for Mental Health. We're the community mental health center that serves Jefferson, Clear Creek, and Gilpin counties. I'm a psychologist. I spent over 10 years practicing, working directly with individuals and families on mental health issues and addictions. And I'm a family member. I lost my brother just over 2 years ago to a drug overdose. This is deeply, deeply passionate work for me. It's a part of who I am, and it's a part of my mission. So for the past year, I've also been learning how to lead a community mental health center. And what I've learned is that what we've built over the past 61 years provides an incredibly strong foundation for the safety net system in the counties that we serve. First, I've learned the value of being a true community partner. We are so much more than just a provider of services, but truly a partner who comes to the table with other community partners to solve challenges, to hear the challenges of the community that are constantly evolving and changing, and knowing that we cannot face these problems and find solutions as individual organizations, but that we have to come together to do that. So through years of collaboration with community partners, we've developed a number of models of care that cross systems and make a positive impact on people's lives. So a few examples of those that I just wanted to share with you, and there are many, but just a couple. One example is in the past couple of years working with other partners in Jefferson County to develop a family justice center, a one-stop shop where individuals who have been victims and survivors of violence can come together to receive behavioral health supports, engage in the legal process that they have to undertake, and really do that in a comforting environment with childcare and resources wrapped around them. Launch Together is another example of a community partnership collaborative that focuses on bringing social and emotional health and well-being to young children and their families by really offering holistic care wherever the family needs that. So whether it's in a primary care practice, in our outpatient offices, or in the family's home, really making sure that they have health care, behavioral health care, and all of the resources that they need to thrive in their lives. Our services that are offered in the community really provide the depth and breadth of services that we offer. We have 8 co-responders who ride along with law enforcement and sheriff's deputies to respond at the point where someone needs that care in the community. We offer prevention and therapy services in over 45 schools. We provide behavioral health professionals in over 35 primary care practices. And so many more, nursing home facilities, the county jail. Our goal is to provide the services where the people need them so that it doesn't have to be something that they have to search for or go out of their way for. There are thousands of stories of success that I hear every day. I can't even begin to tell you all of those, but I know that what works is when we respond to an individual in crisis who is at risk of being incarcerated, and instead of going to jail, we talk with that individual, we see that individual as a person in front of us who needs more than they're getting. We follow up with them right in that moment, and then again the next day, and engage them in services, and divert them from the criminal justice system. When we notice a child in school, because we have our therapists in the school, we notice a child whose behavior has changed. They become more isolated, more withdrawn, and we check in with them. Our behavioral health provider says, "How are you doing? You want to come talk to me today?" She realizes that he's been contemplating suicide. And by engaging with that child and his family, are able to work with them in the school and in the family's home to make sure that he gets the services that he needs, the family gets the support that they need, and now he's thriving, doing well in school, engaging socially, and he's alive. When a woman has been struggling with her methamphetamine addiction and has lost the custody of her children, and she finally asks for help, and we're able to support her with immediate withdrawal services, for she was there for 5 days, and then immediately engage her in our recovery housing program, where she stayed for a number of months while working on intensive outpatient services, and is now gainfully employed and working on regaining custody of her children. I know that there are gaps and there are cracks in our system. There are gaps in this solid foundation that we've built. These gaps largely stem from an increasing of number of people that are lining up at our door and a severe shortage of behavioral health providers to meet that need. There's increased competition for providers against multiple sectors, and people are sometimes having to wait longer than they should to get the care that they need. And truly, that is unacceptable. That is something that I spend a lot of time worrying about, thinking about, and not sleeping about. When someone knocks on our door, when someone finally has the courage to come and ask for help, when they've been struggling in silence for years and they ask for help, they should not have to wait for that care. But we ask them to wait sometimes because there aren't enough providers, because we can't afford to provide the amount of care that they need if they have private insurance, because we're spending time, hours, completing paperwork for the multiple payers that we're reporting to. And again, this is unacceptable. So we need to focus on new innovative tools that improve our clinical process. We need to focus on what we can do internally to be more efficient, to spend more time with the clients that we serve. We need to advocate for reimbursement for services so that everyone gets the care that they need regardless of their ability to pay or the insurance that they have. We need to advocate to reduce administrative burden that takes time away from being face-to-face with the people that need us. And we need to make sure that we support financially and emotionally the people that we employ to provide this care who do incredibly important and hard work. So I hope that we can accomplish that together because this is not something that any one of us does alone. Thank you.